Hello, my name is Bob Baxter and I'm the president for the Toledo and Lima market of Bon Secours Mercy Health. And I'm incredibly excited to share with you today some of the work that's been done on graduate medical education in the market. And this has really been a journey that spanned several years, from concept to approval to implementation of even grander ideas as we move forward. And so graduate medical education is incredibly important for Lima for a whole variety of reasons. And I think it really goes back to what our ministry and our mission statement is, and how do we serve our community, how do we take care of the healthcare needs of the people that we serve, and help improve the community as a whole. And one of the ways that we can do that is graduate medical education, and it ties directly into so many of those attributes that we're looking to accomplish.
As you begin GME programs and hospitals that have GME programs, the literature would clearly suggest that not only does patient care get better, but the quality and safety of the patient care also get better. Basically, if you think about it, physicians who are teaching have to stay up to date. They're being basically pressured by their students, but with questions, etc. So they're constantly relearning and learning the latest and greatest in evidence-based medicine, and it generally impacts the patient care because of that. So, physicians stay up to date, and so quality and safety inside the hospital go up.
You go through 4 years of undergrad and then 4 years of medical school. And the first 2 years of medical school are all book learning. And the second two years of medical school are usually you're doing a rotation. You go to cardiology, you follow family medicine around, orthopedic surgery. You go through all these different rotations for 2 years. During that time, these students will have also been exposed to some sim lab experience. So simulation lab is a part of a lot of it. Computers are part of a lot. They still have gross anatomy labs and a lot of biology that they take, but a lot of things they're doing on models, human models, and they're learning through computer simulation and a lot more computer tests. So technology is a real big thing in medical education now. So they've taken 2 sets of boards. So there's board step 1 and step 2, and now they've chosen which field they're going to specialize in. So the ones coming in the family medicine residency want to be excellent outpatient physicians. They'll also take care of the inpatient as well.
Nowadays, we have vastly different capabilities for teaching. The simulation center that we hope to build will have models that closely mimic what a real human being could be. This is going to be a vast learning environment where our residents can network with one another and improve their learning skills. They'll be able to develop their procedural skills. The center that we propose actually has a floor that is dedicated to research, where we can actually push the boundaries of medicine, both locally and nationally, and perhaps even internationally, from Lima, Ohio, to further improve patient care in just about any specialty that we cover here. This will be an ongoing gift to the community, maintaining young, vibrant physicians and a pool of excellent clinicians in our community.
Retaining great providers to our community is a major focus area for us. For folks such as myself that were born and raised in the community, we recognize some of those tremendous benefits and those wonderful things that the Lima area community has to offer. But sometimes it takes that initial ask to folks and that recruit for folks to come in, live here, and experience it. It's something that you don't get in a short interview situation, but by having a residency program and having residents move here with their friends, families, and loved ones, it gives them a chance not only to gain the necessary education for their profession, but it gives them a chance to experience our community the way that we do, and that's an incredible motivator to be able to retain folks for many years to come.
It's good to have GME or have residents that are going to become specialized in a certain area of medicine in the area, because a lot of times you go from undergraduate to medical school and then to residency. Once you're getting into residency, you're starting to get into marriage, to children, you're starting to want to settle down. And then as you start to settle down, you start to grow your roots, and then a lot of people want to stay somewhat close to the area that they've trained because they've already got an established lifestyle. So that's a nice thing, that if you have GME here in the Lima area, you'll be able to retain some of those physicians that sometimes can be very difficult difficult to retain in any given area, whether that's Lima, whether that's a larger city of Dayton. There's always going to be certain specialties that's hard to retain. So if you do the teaching of those people, then you're more likely to be able to have those subspecialties in your area.
I am incredibly excited about GME coming to St. Rita's, and in particular the opening of the new family medicine residency program. I've been involved with recruiting our first class, and we just matched with 6 excellent incoming residents that'll be starting here in June. And I've really enjoyed teaching so far. I've had the opportunity to host a number of medical students at my office from Wright State University, and it's been a pleasure to be working with them, and I'm excited that we're going to be able to work with even more advanced learners. Mercy decided to open an office 4 blocks from where I live in Bluffton, Ohio, and so I decided that I wanted a walk-in commute and wanted to be working with the community where I lived and serving those people, and ended up coming to work with Mercy Health Bluffton Family Medicine at a brand new practice that they opened in Bluffton, and have really enjoyed that opportunity to get to work with people that I know in a community where I live. And I feel like it's been nice to see services on site locally too. We have lab, we have x-ray, we have a lot of energetic staff and people that we work with, and it's been a good experience. We've made a lot of friends in the community, and it feels like home.
Other residencies, the closest ones are in Toledo, in Dayton, or in Columbus. That doesn't necessarily help our region for access, caring for our patients, or recruitment. So by bringing residencies here, we hope to benefit and become truly the regional referral center for all the counties in our area to improve access to the patients and our friends and families that live around us. And we have designed our residencies to have a very leadership focus. We want not only to graduate excellent physicians, which we will do, with the experience and the team that we have, that's almost a given. But we want to develop people who, the minute they graduate, are comfortable and well equipped to step into healthcare leadership and help make our place and our communities better.
I'm really excited about this opportunity, especially for us in our business. Last year we placed over 7,000 people to work in the Northwest Ohio region. That means a lot of our people visit many different areas and many different hospitals. For us, it's a concern that there is going to be a shortage of doctors in the future, and maybe even in today. So by bringing this program to Lima, hopefully this is going to have a wonderful impact to Lima, Allen County, but not only Lima, Allen County, as well as our region. And indirectly, that's going to have a positive effect on our business and many of the companies that are associated with our business as well. I've always loved the mission of St. Rita's. When I hear people say to help the poor and underserved, what a great value to be able to have something in our community that is doing just that. Just a few minutes ago, I was talking with one of the staff members on how we can educate the community in many different ways, from second graders or kindergarten all the way up to college students. And this building's going to be the perfect opportunity to do just that for many different ages.
By the residents coming into town, it's going to increase the level of care within the hospital. It's going to increase the level of physicians in the hospital, because now typical physicians are now teaching physicians. So it'll increase their capabilities and qualities. And as the residents come into town, these are people that are going to have families or a spouse, and they're going to be coming into town and bringing all their needs with them, and we as a community must be able to meet and fulfill those needs, with the ultimate end goal that these physicians or residents, when they become full-fledged physicians, will stay in our community and add to the level of care here at St. Rita's and in the surrounding areas. As an employer in this community, recruitment and retention of good employees is difficult, especially in times like today or nowadays. And we're not alone. A lot of the major employers in town have that same problem. The level of and quality of care that this hospital will be able to provide in the future is a huge recruitment tool that we'll be able to use, and I'm sure other employers will be able to use. It's not only good for, again, the individual that's going to receive care here, but also for their families, their kids, my kids' families. It's just a reason to be here and a reason to stay here, knowing that the quality of care is going to be nothing like it's been in the past.
We invite you to learn more about the GME program.
This is a win-win for both the community and the hospital, and we look forward to your support.